Thank you very much, Mr. Chairman. Ms. Cabot, I was very concerned when I got reports about veterans and their families who were cut off from the caregiver program really abruptly. So I'm glad your department announced to stop that practice until it can get a better handle on things and figure out the program's eligibility rules. But I'm very concerned by the department's plan to issue guidance on enrollment criteria and seek to reprioritize who is helped by this program. And as I talked with Dr. Shulkin last month, I'm open to hearing your ideas on changes to the eligibility criteria, but I expect you will consult with me before the department attempts to make any changes to who can be helped by this critical program.
Absolutely, and I certainly can't speak directly for Dr. Shulkin, but I believe what he and I have discussed is that he really wants to look at the overall way that VA is approaching supporting family caregivers. And certainly the program of comprehensive assistance is one way that we do that, and we need to make sure that we're doing that well and be able to then look at all of the other areas in which we're supporting caregivers, including veterans who are caregivers themselves. That's an important piece, as well as our caregivers of veterans who were injured or ill prior to September 11th. And so there's a lot of different options and lots of different discussion. There is no definitive plan right now to change eligibility. We are working diligently on issuing a directive, which is the official policy on the current program, and I'm hopeful that that will be published within the next month, and that will really provide a framework that's consistent with the eligibility that we have now, but it will make decisions more transparent for veterans and their families.
Well, will you keep the suspension in place until you've completed all of the actions needed to improve the program, including the pending GAO and IG recommendations?
The GAO recommendations surrounding the development of an IT solution, I do not believe that our plan is to keep the suspension in place until we have that new IT solution. I can take or get you a more specific update on what's going on with the IT solution. I can take that for the record and get that back to you quickly.
Okay, I would like to see that. And I want to know if you can assure me that the veterans and VA staff across the country are going to get very clear national guidance on enrollment criteria?
Yes, I can assure you of that. And I can also assure you that we are going to increase our oversight from the central office perspective, and we have a variety of different things that are being discussed and will be implemented prior to returning to discharging veterans and caregivers from the program.
Okay, well, in an earlier study by the VA, the department found that for veterans in the caregiver program, their inpatient hospital admissions decreased by 30%. And the VA also found that when a veteran was hospitalized, their length of stay decreased by 2.5 days. So tell me, how important is it to veterans' health and quality of life to spend less time in the hospital and more time at home?
It's essential, and I think everyone in VA believes that, and we're moving forward with working to providing comprehensive support to all caregivers of veterans. I do think it's important to note that that initial study that you're referencing was done without a comparison group, and more recently we have been able to compare veterans whose family caregivers participate in the program of comprehensive assistance to veterans whose caregivers have not participated in the program of comprehensive assistance. And those veterans whose caregivers do participate access more outpatient care, more specialty care, more mental health care. They're more engaged in treatment, which is really an important part of helping veterans get to their highest level of independence. That research, and I'm happy to meet with you and discuss this in more detail and actually have the VA researcher with me to talk more about it, did not demonstrate that there was a significant difference in terms of inpatient stay or ER visits. Part of it is that the post 9/11 veteran population are fairly low users of inpatient stays and ER visits, so there is not, it's difficult to get a substantial difference because they use those services less than other cohorts of veterans.
Are you working at all to expand research to find out
Abs-
what the improvements are in the,
Absolutely. We have ongoing work with VA researchers at the Durham, North Carolina VA. And again, I'm happy to meet with you and your staff and talk more about all that we're looking at.
okay, and I also just want to say that there was a September 2014 GAO report that had some really important concerns about the caregivers program, including very high workloads of our veterans per caregiver support coordinator, and you can get it back to me on the record, but I want to find out where you are in hiring new caregiver support coordinators and getting those personnel into the field
Absolutely.
so that this program can work.
Oh, absolutely. We have made significant strides. We're up to about 350 caregiver support coordinators across the country, but I'm happy to get you the specifics around ratios.
Okay, because I did include additional dollars in the FY
you did.
2017 for that, and I want it
You
used.
did. Yes, absolutely. We appreciate that. Thank you.
All right, thank you.